So we're having a conversation about the state of motherhood and all of the challenges that come along with that. But I first want to start with the reality that so many women will not survive pregnancy and childbirth. Christy, you've done so much work around maternal health, maternal mortality. Can you sort of set up for us the stage? Where are we fighting against this crisis?
Sure. Good morning, everyone. Today in the United States, we are in the midst of a maternal health crisis. And this has been pretty much the status quo since I started advocating on this issue more than 15 years ago. The United States is one of just a few countries that have a rising maternal mortality rate. We lose a woman every 2 minutes in this country from a pregnancy or childbirth-related complication. And Black women are 3 to 4 times more likely to die from a pregnancy or childbirth-related complication. Indigenous women right behind them. And this is, a real devastation, a catastrophe, honestly, and something that, while we are seeing more recognition and more stories come to light and more headlines, the numbers really aren't shifting and probably will not do so given the rollbacks that we've seen in the last couple of years.
So there's a lot left to do on that, unfortunately. Reshma, I want to turn to you. Another crisis has been looming for quite some time, and that's around our declining mental health. The Surgeon General even issued an advisory about parental pressure. Can you talk a little bit about what it is that companies need to do, what do businesses need to do to really address the state of mental health and motherhood?
Yeah, I think the Surgeon General report was so powerful because I think it made clear what we all know, which is that mothers are broken. And they say we don't break, but we do. And part of the reason why I think mothers are broken is I think during the pandemic, we realized that, wait, it's not just that we're not balancing motherhood and being a worker, everyone is. Collectively, all 85 million of us are. And yet, we live in a country where, 1 out of 4 women, we live in the only industrialized nation that doesn't have paid leave. 1 out of 4 women go back to work 2 weeks after having a baby. Christy just shared some really powerful, important stats on maternal health. We are the wealthiest nation that puts the least amount of money into childcare. We don't have a gender pay gap. We have a motherhood penalty. Men get a 6% salary increase for every child that they have. We lose 4% for every baby. So structurally, women are not set up to succeed. We're not set up to survive, much less thrive. But yet we've been told decade after decade that we're the problem, that we're the reason why we're not free or equal. It's because we don't have enough confidence, because we didn't find a mentor, because we didn't color code our calendar, right? That the problem is us. Well, that's a bold-faced lie, right? And it's a strategy that has been used to keep us not just from not reaching equality in the workplace, but now it's a strategy that is dramatically affecting our mental health, as per the Surgeon General report. So at Moms First, right, we are leading the fight for American motherhood. We are organizing the 85 million moms to kind of, I believe that motherhood is the final fight for gender equality, right? It's the thing that is standing in the way of us truly being equal and truly being free.
And mental health also factors into maternal health and maternal mortality. It's actually one of the leading causes of death and maternal mortality. Christy, do you want to talk a little bit about that?
Yeah, we now know that 60% of the deaths that are related to maternal or to pregnancy and childbirth actually happen postpartum. So from the day after you deliver to a full year post-delivery, that's where we're really seeing it. And mental health is one of the key factors in that equation. Before we knew that information, there has been this real emphasis on prenatal care and delivery care, the 24 hours of delivery care. But now that we have the data and can really look at that long span after mom is a mom, and try to really build in resources for her to be able to feel supported when she goes back to work, when she's planning her next child, all of the things that become very isolating and very frightening for women to be able to handle on their own. And again, many of them not having access to mental health services along that journey.
I just want to let everyone know we're going to take some questions, so get them ready. But I have one more question for you before we do that. We're a couple of weeks away from a really intense presidential election. I'm not going to ask you who's going to win, like I did last night, but I am going to ask you, can you talk a little bit about how motherhood has factored into this, into the shaping the priorities in the election?
Yeah, well, first of all, this election is boys against girls. And it's fascinating, right, that it's become about that. And this election is also about the obsession about motherhood. 6 out of 10 women who get an abortion are moms. And the reason why they're getting an abortion is because, again, we don't have paid leave, we don't have childcare, we have huge risk for maternal health. And the other big issue is we don't have affordable childcare. 40% of parents are in debt because of the cost of childcare. For the very first time, we're talking about inflation, but the cost of childcare is actually rising faster than inflation. And so for the very first time in every single state, the cost of childcare is now more expensive than the cost of rent. Okay, so this is the thing. So I have been working on this issue for the past couple of years, and every time I would meet an elected official, I would say, I don't get it. Why are we not fixing childcare or passing paid leave? And each one of them would tell me the reason is because childcare is number 16 on the list, right? It's far behind China and AI and trade. And if we're going to pass it, we need to increase it from a priority perspective. And so at Moms First, about 6 months ago, we said, all right, here's what we're going to do. We are going to make childcare a top tier issue in the presidential campaign. And we did. We started with basically a petition with 15,000 moms that signed to make sure that childcare was asked at the very first debate that was on CNN. And they asked it. Unfortunately, both of those candidates spent most of their time talking about their golf game and 0 time talking about what they were going to do about childcare. So we said, okay, we got to do it again. I got a once-in-a-lifetime opportunity. I'm on the board of the Economic Club of New York, and they had invited Trump to come speak. So the protocol was that they would ask 2 Democrats and 2 Republicans to ask a question. So of course the moms at ECNY called me up and they said, do you want to be that Democrat? I was like, I sure do. And I said, but I want to ask about childcare. And they're like, go ahead. So when former President Trump comes to give his big it turns out he was going to release his big economic plan. There was 200 reporters in the room. He's not expecting to be asked about childcare, even though he should have been because he was told. And I asked my question, which was very simple, and he botches it. Word salad. No one knows what the heck he's talking about, right? And it goes viral. But then guess what happens? Everybody is now talking about childcare. How do we fix it? Is it a tariff? Is it a subsidy? Is it a tax benefit? What do we do about it? And literally for weeks, it then becomes it went from number 13 to number 1. And then in the vice presidential debate, of course, God bless them, the 2 female reporters ask about childcare, and they talk about it for 8 minutes. They're prepared this time. And also, after we asked that question, suddenly both candidates released their childcare plan. So it just shows you, right? Again, the power of us as a collective, as moms, the work that Christy's quite frankly been doing for 15 years before anyone was doing it. It just shows you, what is possible when we actually push and hold them accountable.
And Christy, do you want to talk a little bit about how you're seeing maternal health show up in this campaign?
Yeah, obviously abortion is on the ballot. And as I alluded to before, these rollbacks, there are estimates that the increase in maternal mortality for Black women will be 33%. For Caucasian women, 21%. We're going to get the first report post-Dobbs in a couple of months through the CDC, but it's going to be big. And so mothers and young women and families this is a crucial issue in this election. I just come from Wisconsin. I spent time with mothers who have had anomaly pregnancies and have been forced out of their state to get care, life-saving care. They were not particularly pro-choice people. they have had to experience what this is like, with signs the whole way saying, turn around and change your mind. And it's like, this is not an option. This is saving my life. And then also with providers who are not able to practice and provide life-saving care to their patients. I mean, this is like cutting off the hands of physicians all across this country. And those are also women who are mothers, like providers who are mothers who are, trying to take care of people and their own families and forced out of state to be able to do what they do and what they've made an oath to do in terms of taking care of people. Serious.
I want to open it up to questions. I see we have one up here. We'll just wait for the mic handler.
Well, hi, Sheeta Bina from Insigniam. Not the most profound question, but I'm very curious about how you went from modeling to what you're doing and how you got so passionately involved. I think there's a story there that I'm interested and curious about.
Sure, I'll do it very briefly, but I started my career as a teenager, and so by the time I was a young woman and went back to school, then I sort of started my actual pursuit of life, and that really has involved public health and global health pretty much from the beginning. Smoking cessation and prevention after the loss of my father, and then when I became a mom, I became a global maternal health advocate because I experienced a postpartum hemorrhage after the delivery of my daughter, who's going to be 21 next week. So I've been really advocating on childbirth and healthy options, safe options for moms and families for 21 years.
Yeah, I mean, I think it's so powerful how your own experiences leads to your work and your activism. My parents came here as refugees. I grew up as a working class kid with not a lot of resources, and as a brown kid in a white working class neighborhood where there weren't a lot of brown kids. And so I experienced what it was like to be the other pretty much since I was a little kid. And so I think as I got older, I got obsessed with the ways that we can actually give women and girls power. So first it was girls and coding because those are the jobs of the future, and quite frankly, technology is so key to so many of the problems that women face. And then it was childcare, and now I'm today actually launched a podcast called My So-Called Midlife, because after I turned 45, I just became obsessed with the con of midlife, right? Why is George Clooney hot when he gets salt and pepper hair and the same grays and wrinkles that we do, but we're obsessed with the mirror in reverse? That doesn't make sense. Why does our ambition, why are opportunities closed off to us the older we get, but men just seem to get more and more powerful? And so as I started digging in, it really is a con. And it is a very dangerous con. And so I've launched a podcast to really talk to incredible people, my podcast launched today with Julia Louis-Dreyfus, who is the woman, right, who has really just gotten finer like wine the older she's gotten. To Ketanji Brown-Jackson next week, and really talking about her experience, in really staying steadfast to where she knew she was meant to be. To divorce experts, to sex experts, to everyone who's going to really I want a plan, and part of it's my journey. I want my toolkit, right? How do I make sure that this is the best time of my life? And I'm not just trying to live through it, but I'm trying to live it.
That's great. I know we have another question here.
I'm Hillary Kabla McAdams from NEA, which is a venture capital firm. Thank you for all your work you're doing for maternal health, for women, for moms. I guess I have a question about on childcare. A lot of us in this room have patched together childcare strategies that we think and hope are working. And I'm curious if there are models or countries or frameworks that you've seen that you could point us towards to help us understand what that policy at the federal level or state level or even at a company level might look like.
Yeah, listen, I think this is a great question. So, and I think the women in this room will understand it. Childcare as a business model is broken. Right? There's both a demand and a supply problem. 50% of Americans live in childcare deserts. So most people just can't even find childcare, right? Or if they sign up for it, it's they're on a 2-week-long wait list. Part of the reason why you have a supply problem is we don't pay childcare workers enough. They're the least paid, so they can't make a living. And these are women, often women, who love children. they're exactly the people that we want to be taking care of our kids, and we need to pay them fairly. But if parents can barely afford childcare and child workers are like, can't go into this profession because I can't put food on my own table, you have this issue. So when you have a market failure, it's a market failure. You need intervention. And so the question is it the government, is it the private sector, or is it both? So right now, it's got to be the government, right? They have to, but there has been an utter failure, because I'm just going to be honest, the vast majority of people that are running our country are men who had women staying home, taking care of their kids. They never experienced this. They don't understand why we should be investing in it. And that's changing a little bit, because guess what? They have daughters. And they love their daughters more than they love their wives. And they're like, wait a minute, what? Childcare? I'll take it, okay? So, and then the same thing is happening in business, because for the very first time, companies are recognizing that they have tight labor markets because women are downshifting in their careers because they don't have childcare. So we did a first ever report, but there was no data on this before. So Moms First did the first ever report with BCG showing what the ROI was, and it was as high as 425%. It paid for yourself. If you lose the average employee every 9 months, but you provide them childcare subsidies or benefits, you keep them for 18 months, you make money. So this is basically what people, and I hope everybody in this room who runs a company, who works a company, who actually is able to make these kinds of decisions, just really recognizes, I'll say it 100 times, childcare pays for itself. So not only do we need companies to be investing in childcare, I need y'all to pick up the phone and call your elected officials. Whoever wins this November, we are so damn close to getting childcare done in America. So close. So close, I can smell it. But we need business leaders, because they listen to you, to call your elected officials, whether they're Republicans or Democrats, this is not a partisan issue, to say, I need you to do this. You want to compete with China, right? You want to be the best economy in the world? We got to fix childcare.
And AI is not going to do it for us.
No, it's not. No, it's not.
Or deliver your babies.
Yeah. And last thing, and invest in more entrepreneurs that are trying to disrupt the broken childcare model, because there are a lot of great femtech companies that are thinking about this and that are working on this and that need to get funded.
So we've talked a lot about the issues, the problems, the challenges, and we have some to-dos. Is there something that you're excited about, some innovation, a person, a program that you've seen that should give us hope about where we're going with the journey of the challenges of motherhood? I'll start with you, Christy.
Gosh, I mean, I am hopeful most days, because I think as a mom you have to be, right? Honestly, we're very much investing in the healthcare workforce and doing it at sort of mid-level, the providers of mid-level care, doulas, community health workers, midwives are really essentially important, but they're not being reimbursed either. To your point about caregiving, like, they also are getting left behind. So even if they are proven to give better quality care, have more time for their patients and families, they're actually not getting reimbursed by the state. So we've been really supporting this Black Maternal Health Omnibus bill, a set of bills which are very, very comprehensive and really are looking at all of the different factors that need to be included as we're trying to address this problem. And one of those things is extending Medicaid coverage. Most births in this country are actually covered by Medicaid, 42%, almost 50%. And so having a full year of postpartum care will actually help catch some of those women that otherwise get dropped the moment that their baby is born, or until 6 weeks after. And so that's something that I'm excited about. It's had momentum. There's great leadership, bipartisan. Like, there's a lot that we can come together around. But yeah, we need to take care of people who take care of people, right? We need to be people-centered. We need to be mother-centered. That's the way forward.
Yeah, I couldn't agree more. I am excited because I finally realized that I think we all realize that we've been getting tricked and conned. And whether it is, again, about midlife, or whether it is about, the ability to make our own decisions about our own bodies, I think we realize that we are radically in a different place. And look, I think I'm still thinking a lot. This election cycle has been very fascinating if you take a second to look back and to see what's happening and the resistance, right, towards women in power. And I need all of us to really take a step back and to understand and to process what we're seeing and why they're so damn scared of us. And we now need to stop apologizing for ourselves and take control and power over our own destinies, if not for ourselves, for our daughters. And that doesn't mean, guys, that, and this is the thing that has to happen on November 5th or 6th, it's not a zero-sum game. Just because women get more opportunity doesn't mean that men lose. And we've presented it in many ways, and I'll take responsibility for this as an activist, as a feminist. We've sold it as a zero-sum game. And so whatever happens after this election, we got to have a radically different conversation. We have to radically think about how we come together and bring men along with us, you know what I mean, in a different way. And we as women need to put ourselves first. The amount of women who at this election, and it breaks my heart to say this, who are going to sacrifice their own human rights to dictate their body because their husband or their son feels disaffected, blows my mind. Blows my mind. But if that happens, and I won't say what outcome we're talking about, it will be because women put themselves second instead of first. And we got to really figure out. I was talking to somebody yesterday at the Fidelity cocktail party about the amount of women who they're experiencing menopause and they rather quit than ask their employer for what they need. The amount of young women who rather downshift in their careers because they look around and they think, I can't be a mom here. How do we go back to feeling like we can just ask for what we want? And I saw this last thing so powerfully in this election. You jump in. Sorry, I can go on forever.
I'm gonna jump in. We're out of time, but this was a really enlightening, depressing, but also hopeful conversation.
If we vote, it can be hopeful.
Exactly.
Everybody vote. We have work to do. Thank you so much. Congratulations on your podcast.
Thank you, Jennifer.
Of course.